Bill Blair is Minister of Public Safety and Emergency Preparedness. He is in Toronto. Minister Blair, welcome back to the show.
Thanks very much, David.
So this border plan is dependent on cases staying low in Canada. But what happens if they keep surging in the United States?
Well, I will tell you that we're going to watch it very carefully. And the Public Health Agency of Canada, if it becomes necessary, I am quite confident, is prepared to act as a circuit breaker. But we have made tremendous progress in vaccination. There's still a lot of work to do. We believe actually that the measures we've introduced, because they offer opportunity for the fully vaccinated, I hope that will be an incentive for Canadians who want to travel to the United States to go and get vaccinated. But we're going to monitor it very carefully. Our priority has from the outset been to keep Canadians safe. We're going to do what is necessary to do that. But right now we're seeing good progress in vaccination, good progress in the reduction of case counts. We believe that these are the right measures in the circumstances we currently face.
We're seeing all of those things in Canada, sir, but we're not seeing that in the United States, to the point that the president is quite worried about what's going on there. So if things do deteriorate in the U.S., you mentioned circuit breaker before, do you think we could see the border becoming tougher for even fully vaccinated Americans after the 9th of August?
Well, my understanding, David, is that the problem that they are experiencing with the variants in the United States and in other jurisdictions is primarily among the unvaccinated. We believe the vaccination actually provides, very, very strong protection for Canadians and for others against these variants. And so the measures that are bringing about are only for those who are fully vaccinated. It's also important, before they arrive and can enter Canada, they're going to have a pre-arrival test taken within 72 hours, showing that they're negative. They cannot be symptomatic. We're also going to have a regime of random testing continuing at the border in order to ensure that these variants are not coming into the country. And for those who are not yet fully vaccinated, all of the existing restrictions and measures will remain in place so that we can take the steps necessary to protect Canadians.
Okay, so domestically, this plan has a big caveat that the state of COVID in Canada has to remain what you're calling favorable. So what are the metrics in terms of transmission and hospitalizations that would determine whether it's safe to take each of these steps?
Yeah, well, we have seen, as I've said, right across the country, we're seeing real progress among the vaccinated population in reducing case counts, hospitalizations, and morbidity rates with respect to that. And again, the epidemiologists at Public Health Agency of Canada track this on a daily basis. It informs all of our discussions with respect to the border. As I said, right now we believe that the conditions are favorable and are continuing to improve. But we're going to monitor it very carefully, David. And I want Canadians to be assured we're tracking what's going on in Canada, what's going on abroad. We're prepared, and I think we've demonstrated we're prepared to take action that may be necessary if the situation changes or deteriorates. But right now we're on the right track, and we're seeing real progress as a result of the high vaccination rates. We want to urge Canadians to continue to go and get that second dose if you've only had the first one. For those who are not vaccinated, we're very hopeful that we'll do everything possible to make it accessible to as many Canadians as possible, right, so that we can increase our vaccination rates. We're moving forward here, but we're moving forward with care and with caution, the same care and caution that we've demonstrated, I believe, over the past 16 months.
But on that point, on the same care and caution, we now have August 9th, which is a date in the future, and we know what the projections are, but no one can reliably say what the state of COVID will be in Canada on that day or on September the 7th, which is when it opens up to the rest of the world. So, you mentioned a circuit breaker earlier. What's the threshold for when that circuit breaker needs to be triggered, or when the emergency brake needs to be pulled? Because we've had thresholds for reopening. What would be the threshold for when we need to pull this back?
Well, again, I'm reluctant to offer a hypothetical. We rely entirely on the advice that we receive from the Public Health Agency of Canada and our various scientific advisory boards, that they track the data on this very carefully. We have always followed their advice. We're going to continue to follow their advice. If and when they advise us that we need to take more restrictive measures, we'll follow that advice. But on the current track, we believe we're on a very positive track. We're following the advice that we have received. It is is always possible. And I think, Canadians have to continue to be vigilant and careful with respect to, the public health measures that have been put in place. We see that the provinces and territories are beginning to move towards an easing of restrictions, but we'll continue to track the data very carefully. And if it's necessary to bring back more restrictive measures, we're quite prepared to do that. But I think as well, Canadians are seeking clarity and certainty on the border measures. It's why we've given them like information about what we're going to be doing August 9th and then again on September 7th. I think if we continue to work hard together towards improving the situation, getting those vaccinations done, following our public health, public safety measures that have been recommended to us, and if we all remain vigilant and careful, we believe that there's a light at the end of the tunnel, and we'll work hard towards it.
I know when last we spoke, the light at the end of that tunnel was triggered by 75% full vaccination. We're not there yet as a country, but we should be by around the 9th of August if the current pace of vaccination continues on second doses. Is that still the threshold that you have to hit for this to happen? Like, is this happening August 9th no matter what, or do we need to have that 75% fully vaccinated eligible population metric hit?
I think we're very much on track for us to be able to achieve that. We've been working with our CBSA and the Public Health Agency in Canada to make sure that they're ready. They're making changes to the Can Arrive app, the Arrive Can app, excuse me. They're training the officers in both public health and our border services officers to be ready for that date. I believe we are on track. I will also, and I would never presume to speak for Dr. Tam and the Public Health Agency of Canada, but I know that they are monitoring very carefully the impact of variants, and they're continuing to do their data collection and research, and they'll continue to advise us. But right now, the advice is that we are on track to meet the circumstances that will allow us to make the changes. And let's be really clear, David, these are careful changes. We're talking about allowing fully vaccinated American citizens and permanent residents as the first step. It's an incremental step as we work towards, frankly, the phase 3 of our opening to allow all foreign nationals who are fully vaccinated on September the 7th. And so we'll track very carefully to make sure that we're meeting our metrics, that we are achieving what we hope to achieve as we begin with a cohort of American citizens, and hopefully we'll be able to stay on track. And I think I'm confident, but at the same time I'm cautious. And so we'll continue to listen to the best advice that we receive from our public health officials and our chief medical officer of health. We'll follow that advice as we have done right from the outset.
Until today, you've been in total lockstep with the United States on the border. It feels like we're diverging now in our approach, and that Canada is laying out a path for vaccinated Americans to come here, but the U.S. is not reciprocating, and your expectation is that they're going to roll over the border restrictions on the 21st to continue for at least another month. I mean, do you have a sense of when Canadians are going to be allowed to drive into the United States without restriction? Have you given any indication on that by American authorities?
Yeah, just to be really clear, we're actually rolling over our restrictions on non-discretionary travel for the unvaccinated, just as the Americans are. We have been largely symmetrical, but not perfectly so. David, it's always been possible.
Canadians,
for example,
when will vaccinated Canadians be able to go into the United States by land without quarantine?
And that's a decision the Americans will make. I know that it's very actively under their consideration. We have advised them of the measures that we're bringing into place on August the 9th. That they're aware of that information, and I think that our continuing collaboration with them. We're in almost daily discussions with our American colleagues. The border between our two countries is very important. We recognize, the ability of Canadians to travel for non-essential purposes, essentially discretionary travel in the United States. Throughout the entire pandemic, Canadians have been able to fly into the United States for non-discretionary travel, but they haven't been able to cross at their land borders. And so that was an element of asymmetry that existed between us. But we work very closely with the Americans. I'm confident they're making progress as well, and they're moving cautiously towards a border easing measures which are appropriate to their country. Keeping in mind as well, David, their border is not just with Canada, but also with Mexico.
Right.
And so they've got to take all of their circumstances into consideration, and they're doing so. We believe that the measures that we've introduced will allow, first of all, American visitors after August the 9th to come to Canada. For Canadians who are able to go into the United States, it's going to be a lot easier for them to return because they will no longer, if they're fully vaccinated, be required to go into quarantine. And so this is, I think, a careful and measured reopening of our border that begins with fully vaccinated travelers, because the scientific evidence and advice is that they are the most safe people to be returning.
One more question, if I may. This is this easing of restrictions for people vaccinated with Health Canada approved vaccines. There are a lot of Canadians abroad who have gotten Sputnik or Sinovac or one of the other vaccines that's not on the Health Canada approved list. What's the timeline for easing restrictions for people vaccinated by non-Health Canada but World Health Organization approved vaccines?
Yeah, well, I don't have the precise timeline, but I can tell you that there are discussions between our public health officials and the WHO and globally with many of our international partners about those other vaccines. I remain confident that when that work is completed, that we will have an arrangement with other countries that will respect the approach that Canada has taken to vaccines, because our approach has proven to be very effective, David. You know, we've allowed people to use mixed schedule vaccines. We've also put a great deal of emphasis on getting that first dose as many people as possible. The approach that has been advised by our public health officials has proven to be very effective, and we're going to continue to rely on their advice. When the Public Health Agency of Canada and Health Canada tell us that the other vaccines that you mentioned are approved for travel, then we'll make those changes, and not until.
Okay, Minister Blair, thank you so much for your time.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.